What was the mRNAs? It was like I think it was like you had to like put it in something much deeper. I think it was like you almost had to like use dry ice or something when you were transporting it. Like how cold did that? I think it was like really cold.
So
It was
minus
not
80
it was
degrees
not fridge.
Celsius. Yeah, minus 80
Yes,
degrees
yeah, there you
Celsius
go.
initially. They eventually revised the formulation so it was more stable at minus
Mm.
20, but minus 20 was how cold they had to freeze it.
And minus 20 is a lot colder than like that's colder than a freezer. That's how cold it
Yes,
is.
it's a very
Um,
cold freezer.
yes, for people listening, what you're developing the data and the machine learning aspects of what you're building. Do you ever see a component where you could not necessarily bunt it off, but make that like an open source thing that people could build on and develop with you, and translate it into what other things that you want to do? Like, so like you could focus on what you're doing, have that aspect be open source so that you can continue developing it, potentially galvanize like that's like a global population. There's actually a lot of really interesting research coming out that the private LLMs, for instance, are like winning the day for right now, but there's a lot of stuff coming out for the open source LLMs that suggest that they might actually be the thing that wins, kind of like Linux in terms of being an open source operating system. But anyways, that's just logic for potentially doing it. Do you guys ever think about open sourcing something like as an example like that so that other people could work with you in developing it?
No, that's a great question. And I think we haven't had a specific situation where we had that
Yeah.
choice. We've been so
Mhm.
focused on, very precise applications of machine learning that we can't imagine how it might be useful for people to play around with it. But I can certainly see us getting to that point once we've scaled. Sort of an analogous question isn't machine learning, but it's in the platform itself. We talk about, should we exclusively work with companies to do a specific drug, or should we be non-exclusive and sort of give it to everybody to try out their own things? And I think we've been talking a lot about that. I think initially we're going to have some exclusive relationships, with Eli Lilly, for instance, to develop drugs. And once we get a few wins across the finish line and the safety's demonstrated and the confidence that we can create more successful drugs is there, then we'll think about, more broadly making the platform applicable to many different diseases.
Yeah, I'm familiar with Bill Gates and Microsoft, where there was an option with IBM, I believe at the time, where they were going to be an exclusive licensing of their DOS system, but then Bill Gates was like, "Nah, you don't need it." That worked out to be really great for him.
Right.
I don't know how does that work in terms of the biotechnology field? Is it normal to have an exclusive license with a couple of people, or is it normal to not have exclusive and the people just can use it for their like? I guess that's the same thing. How does that work for biotechnology?
Yeah, so I mean, the idea of exclusive is, say you want to work on, let's say,
Yeah.
Crohn's disease, and I let you use my technology for Crohn's disease, but then nobody else
Okay.
can use it, so you have exclusive rights to it. So those are the kind of relationships we've had in the past. I think, again, once the platform is proven to a point where we know we can develop, many different drugs, it may make sense to be non-exclusive so that we could have multiple companies working with the same platform on the same disease,
And
that would increase the chances overall of success, right?
Yeah. What and you'd be able to achieve that by eventually their exclusive would just run out and then you just don't renew it? Or like how would you go from a state of some exclusivity to non-exclusive, like people can use wherever?
Yeah, so if you think of all the diseases that are out there, we probably out-licensed exclusively less than 10% of those areas. And so we have, over 90% available still to either develop ourselves or have relationships with companies to develop those drugs. And so, yes, we're considering,